protecting our veterans from coronavirus, the Department of Veterans Affairs has seen a sharp increase in virtual care during these challenging times.
Joining us via Zoom this morning is U.S. Secretary of Veterans Affairs Robert Wilkie. Secretary Wilkie, thank you so much for joining us this morning.
Well, thank you for having me, at least virtually getting me out of D.C.
Absolutely, sir. The VA's telemedicine numbers have skyrocketed since the pandemic began. What are some of the challenges the department needs to still overcome to improve telemedicine moving forward?
Well, I'll give you the numbers quickly. In a normal month, we do about 40,000 mental health tele-appointments. In June, we did over 900,000. We've stressed the system. The biggest challenge is not the system itself, because we have now proven that can work. The biggest challenge is making sure that rural veterans have access to telehealth. The greatest number of veterans in this country live in rural America. That's the highest percentage. And increasing bandwidth out in some of the more remote parts of America really is the biggest challenge. And we're working with the Congress and with the administration to try to increase that availability.
That is good to know. Mr. Secretary, you also know the VA is helping state-run long-term care centers take care of residents who test positive for coronavirus. Tut Fan State Veterans Home in Huntsville is reporting more cases within their resident and employee populations. So what's being done to protect patients and employees there?
Well, we're not involved in the Tut Fan nursing home. We're in other state veterans nursing homes across Alabama. We are separated by law from state veterans homes. Mm-hmm. We can't control, manage, or run any of them. But what we do is, in fact, in Alabama, we've sent 40 nursing teams across the state to state veterans homes and also to community nursing homes to make sure that best practices are being followed. And in our hospital in Birmingham, we've taken in patients from state veterans homes. So we are out there preaching good practices. We're sharing equipment, and we are sharing our employees with those homes to make sure that our friends in the state homes get as best treatment as possible.
Well, that's good to know for sure.
Mr. Secretary, from the mental health perspective, does the VA have enough qualified individuals to help take care of those suffering with mental health issues, especially after we're seeing these long periods of isolation?
Sure, and that's where telehealth comes in, because it allows our VA employees actually greater reach into the community. One of the good stories to come out of this is that I've been able to throw away the old book on hiring and employment. Just in the last 9 weeks, we've hired over 30,000 employees. 90% of those are permanent. That's well over 6,000 nurses and mental health workers. So we've actually been helped by the emergency, and that I've been able to throw away the old way of doing things. So mental health, telehealth, and also the increased number of employees is a big boon to those veterans out there who need our services.
Mr. Secretary, cities like Huntsville, who have a large veteran population and VA clinic, but also sending a lot of its patients an hour and a half away to Birmingham, you just mentioned Birmingham, to get some specialized treatment there. What is the VA doing to make sure that care and the needs are being met here?
Well, the one problem that we have had with the emergency is that our expansion of veterans' choice, meaning choice in the community. If we can't provide a veteran what that veteran needs, we find an appropriate place in the private sector. Because of the epidemic, many of our private sector choices have closed up. We're at about 70% of where we were when we started this Mission Act choice back in June of last year. So we expect that to be coming online more rapidly in the next few months. But right now, with private health care contracting, the best thing that we can do for specialized services is to get folks down to Birmingham. But when things return to normal, it'll be more likely that veterans in Madison County and the surrounding areas can stay home.
Secretary Wilkie, we have about 30 seconds left. Can you briefly touch on the fourth mission that's added with the Veterans Affairs Department and how you guys are helping during the pandemic?
Sure. People in Alabama know about our fourth mission just from natural disasters, particularly on the Gulf Coast with hurricanes. That fourth mission also includes help for epidemics. So we have opened our hospitals to non-veterans. We've sent, as I mentioned, we have 40 nursing teams spread out across the state of Alabama, helping state veterans homes and nursing homes and hospitals with care, not just for veterans, but for non-veterans. Right now, we are in 46 states, including the Indian nations. We've got nurses learning Navajo right now to help bring better health care to members of that tribe. So that is our fourth mission. We are foundational for the federal response, and we have accepted that mission gladly.
All right. U.S. Secretary of Veterans Affairs Robert Wilkie, we surely appreciate your time this morning.
Thank you for having me.